Well, many times what happens is it comes down to the woman. So she's the one that gets pregnant. It's all her responsibility. It's no one else's responsibility. It has to be a family responsibility. They have to know about protection. They have to know about protection against sexual transmission of Zika, which is something that has recently come out very clearly, that there are sexual transmission for Zika. So if you're looking at Zika, these mosquitoes bite at all times. And so you have to have personal protection. It's not enough to protect your house. You have to protect yourself. With repellents, you have to make sure that that's understood. The vertical transmission of mother to child is another major issue that has to be understood. It isn't just the mosquitoes. You have to stop getting bit. You have to do prevention, but you also have to realize what this means. If someone is infected, what happens to that child, and how do you set up the system so that you can take care of these children when they're born? Because regardless, some will, until there's a vaccine, there will be some people that will be infected, and we're going to need to figure out how to deal with these children. One of the areas where APT is really strong, and this was I knew before I came to APT, is in health system strengthening. How do we set up a system that will be good in the long run, that will be a robust healthcare system? So if you have strong health systems in the countries around the world, you're going to protect people in America. So it's important that you look at it from that perspective, so that if you have a strong system that can stop someone who's has Ebola from getting on a plane and coming out, you can stop the epidemic there so it doesn't spread as far. There's never any one response to an epidemic like this. There wasn't a one response for HIV. You couldn't just teach people. You had to have biomedical responses. You had to have systems in place. You had to get new technologies that you could use. You have to look at the biomedical side, the physical side, the behavior change side. And if you don't look at all three, you're not going to make a lot of changes.